This video has been created by doctors, nurses and therapy staff with a passion for reducing the harms caused by poor patient flow. We want to share stories, evidence and resources to give colleagues food for thought on this issue. Resources will be embedded in links beneath the video.
We do understand the huge challenges of working in the NHS at the moment, yet we still believe small changes in our actions can make a huge difference to our patients.
Sarah was admitted to the ward 10 days ago. She's deconditioning due to spending so much time in bed. What really matters to her is her dog and her grandchildren, and she wants to get back to them. She's worried she may not be able to walk her dog when she gets home as she is feeling weaker. Although a consultant sees her daily after the board round, and she is well known to the nurses and physiotherapists, Sarah is still not sure of the exact plan to get her home. Her family keep telling her hospital is the safest place for her, but is it?
This could be any of our parents, grandparents or relatives. Small changes to improve Sarah's journey through the hospital could have an incredible impact on her and might make the difference between her going home independently or dependent on others.
Nurses, doctors and therapists like us tend to focus on the patients directly in our care. However, it is important to realise that our actions have an indirect impact on many other patients too.
By ensuring patients like Sarah have a clear plan for discharge, they are likely to leave hospital in a safe and timely way. This in turn can have a positive impact on several other patients and the doctors, nurses and therapists taking care of them.
For example, Layla, a child with cerebral palsy and a learning disability, is waiting for admission to the paediatric ward for her chest infection. She is frightened by the emergency department's environment. The nurses looking after her are doing their best to make things better for her, but it feels impossible as the department is so overcrowded. When Layla transfers to the ward for the specialist care she desperately needs, they are able to move on to supporting the next child in need.
And Zach, who has a sudden cardiac arrest in the community when out with his friends. The paramedics are able to swiftly hand over their last patient to the emergency department and rapidly get to Zach in time to save his life.
We all want to do the best for our patients, but sometimes things get in the way of this. Within our available resources, is there anything we or our teams could do slightly different to improve the patient's journey through our hospital?
We believe that there are small steps that we can take individually and together as multidisciplinary teams to make a difference, and have gathered resources together to support those wanting to try something new.
We are also working hard to influence system and hospital trust leaders to support you in changes you want to make.
The regulators are behind this too. For example, the Care Quality Commission recently published a document called People First that is behind system leaders wanting to reduce the harm in the UEC pathway.
Thank you for all you have been doing and will do in the future to ensure safe, good quality care for all our patients.